Welcome to the second of our special Arden Wood Presents webinars on Medicare and supplemental insurance, exclusively for California residents. Today's presentation includes new information since our November Medicare webinars. This new content is time sensitive and may convince you to change your current Medicare coverage, especially if you're in a Medicare Advantage plan. I'm John Mitchell and I serve as Executive Director and CEO of Arden Wood here in San Francisco, and I want to thank you for joining us today. And welcome back to those of you who attended Tuesday's webinar. Today we'll feature the same presentation, but a batch of new questions. As you well know, this is not easy stuff to understand or to remember. We will continue to offer these webinars as a review or whenever there is new information to share. You know, for generations, Arden Wood has been a refuge for Christian Scientists and their families. It's been fondly called a healing house, where there's an expectation of quick and whole healing for anyone who comes for care. It's also a Christian Science nurses training center, and it's a beautiful residence for Christian Scientists who are fully and happily engaged in ageless living. Most of all, Arden Wood is an idea that has evolved seamlessly over many generations, and that will continue to evolve to meet specific needs in ever-changing times. Arden Wood exists because you value a place where you are free to have a healing through the practice and application of Christian Science. Informational and educational webinars like this one on Medicare, estate planning, the Bible and inspirational topics, our annual meeting and our Christmas celebration are among the many ways we offer proof of our utility in service to the Christian Science field. You can find a replay of most of our online events on our website, ardenwood.org. And please visit our redesigned website next week at the same time, at the same address, as we'll be transitioning to it over this coming weekend. I think you'll like it. Arden Wood is a 501c3 charitable nonprofit organization. This means it requires income from our patients, residents, and guests, as well as donations from you to meet our operating expenses. You are invaluable to Arden Wood. Your support enables us to offer uninterrupted Christian Science nursing services, something we've been doing since 1930, along with inspiring programs like this one. You bring out the best in us, truly. And finally, the content being shared today is offered for informational purposes only and is not intended to be legal advice. Now, I understand that a number of you have already talked directly with our presenters, Jim, Leslie, and Rogers, since our previous Medicare webinars in mid-November and on Tuesday of this week. That is great. Please feel free to be in touch with them with any additional questions. That's the purpose of all this. Their contact information will appear on the screen at the very end of this webinar. Also, due to the level of interest in understanding your healthcare options, we are planning a follow-up webinar on long-term care insurance in early March. Now, please note that this is a change from what we had planned to host in late January, so now it's going to be in early March. We'll email you with details early next month, so please tell your friends and hope you'll tune in. And now let me introduce today's presenters. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He has been helping individuals and companies navigate Medicare since 1989. He is a frequent guest speaker at law firms, CPAs, medical groups, school districts, Rotary clubs, and large and small companies alike. Jim is also a certified long-term care insurance strategist. He specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim lives in Lincoln, California, just north of Sacramento, with Teddy, his wife of 34 years, and I love to always say this, Jim, they're spoiled rat terriers. Leslie DeFrisco serves as Arden Wood's Director of Christian Science Nursing Services. Leslie oversees basically everything related to Christian Science nursing here, including our Christian Science Nursing Arts Training Program with a new class that started today. We are so grateful. Leslie graduated from the Mother Church's training program and has been journalisted since 1981. One of Leslie's responsibilities is to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, she is an unsung hero for her diligence and competence in wading through the many intricacies of Medicare. She is joined in this effort by another Arden Wood colleague, Speer, who processes our Medicare and supplemental insurance paperwork. Rogers will join Jim and Leslie during the Q&A period. Arden Wood is just one of 10 Medicare Part A Christian Science nursing facilities in the United States. The other two in California are Broadview in Los Angeles and Sunland in Encinitas down in Orange County. And finally, before I turn the program over to Jim and Leslie, let me briefly explain how you can ask questions. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Just click on it and a screen will appear where you can type in a question. Then press submit and it will arrive here in my office. We will collect them and save them for the end of the presentation. Based on the number of questions we've received during the previous webinars and back on Tuesday, we'll extend today's Q&A until about 5:30 or so in order to answer as many questions as we can. So please join me now in welcoming Jim and Leslie.
Good afternoon. As a longtime Christian Science nurse, I've had the privilege of witnessing many healings, both in Christian Science care facilities and in homes. Christian Science nursing does not include any kind of medical care, but it does provide practical and skillful care for individuals who are fully relying on God for healing. Christian Science nurses are not just personal caregivers. We do so much more than assist with bathing, mobility, cleansing and bandaging, and making you comfortable. We are spiritual witnesses, beholding the perfect man. We expect quick and whole healing, and we take a stand for the ever-present healing power of the Christ. We are part of the healing team, including the patient and the Christian Science practitioner. Over the years, I've seen that many Christian scientists don't know if they have Medicare or know that they can use it at Arden Wood or other Christian Science nursing facilities. So today, Jim and I are going to briefly explain Medicare coverage for Christian scientists and share some other options how you can afford care in a Christian Science facility. Specifically, Jim is going to talk about original A and B Medicare and plus a new supplemental insurance opportunity that's available to residents of California that might be of particular interest to Christian scientists. Take it away, Jim.
Hi, everybody. I'm getting my screen up here, hopefully, so everybody can see it okay. How are you? Thank you, Leslie. Thank you, John. I got to tell you, I absolutely love talking to Christian scientists. You're a pleasure to deal with. I love getting all your calls and your emails. And I've learned a lot from everyone from the Christian Scientist community. So I'm a Christian myself. I wish your faith is incredible. I believe in prayer, and you're just incredible. So I'm going to go through some of the basics of Medicare again. I'm going to take my time because I think I've realized a lot of people just don't understand basic Medicare because it is so confusing. And you hear so many stories from your brother-in-law, your neighbor, your coworker, from watching Joe Namath do his commercials on TV to everything free and Medicare. And it's so confusing out there. So we'll just go through a few of the basics. And Leslie's going to help me with when we talk about the religious non-medical healthcare institutes, right? Leslie, otherwise known as a RNHCI. So I'm learning all the acronyms.
You are learning beautifully, Jim.
Thank you. All right. So first, I'm going to tell you a little about myself. I have been doing this going on my 32nd year. I'm a certified senior advisor, and that means a lot. That means I study daily. I read Medicare, Social Security. I really try and understand all the wants and needs of people 65 and older. I love dealing with people in that age group. I was fortunate to be raised by parents who were quite a bit older. And when I got into this business, that's when I really I really you kind of pick a niche, and that's, I started getting involved with Medicare and long-term care, and I just absolutely love working and trying to help people. So I'm also a long-term care insurance strategist, and we're going to talk more about that, I believe, in March. And I'm not affiliated with any government agency. I forgot to say that last time, so that's super important. I'm not part of Medicare or Social Security or CMS or anything like that. I always tell my clients one of my goals is really helping them mitigate healthcare costs in retirement. That's super important. So just a basic agenda for today. So I'll stay on track because I do like to go off on tangents. So Leslie, just wheel me back in. So we're going to talk about just some of the basics of Medicare, parts A and B. And Part C, I hate giving you all these initials, but Part C is nothing more than an HMO type plan. And I actually put a slide in there today that's going to show you so that you can actually see what some of these cards that you have in your wallets, because they are confusing with initials on them, showing that some of you may have Part C and not really know it. John and Leslie both touched on why original Medicare, Parts A and B, especially Part A, really works well for Christian Scientists. And I totally agree with that philosophy. I think original Medicare, Part A and B gives you so many more options and choices that we need, especially as we age. Some of the basic Medicare enrollment periods and why they matter to you, because we're in another one. We just got through one from October 15th through December 7th. They said, wow, that's over. And then they said, well, wait a sec, now we have another one, a Medicare Advantage open enrollment period. So we'll talk just briefly about that too and why it really matters to you. And then there's a special offer today too, especially, and this is only available to residents of California, and we'll go through that. So what is Medicare? Medicare is our national health care plan for people 65 and older, or if you're under 65 with certain type disabilities, after you've been on Social Security disability for 24 months, you're eligible for Medicare Part A and B. It's government-run insurance plan, and I know that's in the news right now. I just read an article today on the new Biden administration looking at possibly bringing Medicare down to age 60. So that's going to be in the news in the next couple months. So they're looking at changing that, not Medicare for all, but Medicare to age 60 instead of 65. This is important. I keep showing these old Medicare cards because some of you have them. If you have a card and it has your Social Security number on there, that's an old one and it doesn't work anymore. You need to get the new one. The new ones look like this. They now have 11-digit encrypted numbers on the card. If you have an old one, or you've got your neighbor or a relative or somebody has an old one, you want to call 1-800-MEDICARE and make sure you get an updated one. It's super important that you have that on there. So talking about some of the parts of Medicare, like John mentioned, both Part A and B work great with Arden Wood or any of the Rankies out there. It's really, Part A is the hospital side to Medicare. I always think of Part A as the accommodation side. Normally you're going to spend the night somewhere, whether it's inpatient in a facility. If it's skilled nursing, normally you're gonna spend the night for that. Or finally, hospice end of life care, you spend the night somewhere, whether it's in a facility or at home. Part B is the medical side, the doctor side. And we'll talk about the cost of that. That's not free, that has a cost to it. But Part B includes whether you see the doctor in his office, urgent care, outpatient surgery if you break a bone, lab work, x-rays, MRIs, physical therapy, things like that are all covered under Part B. Then we're going to talk about insurance options. So right, A and B is easy. Now we have to throw another initial in there, and that's Part C. And it gets confusing because you go, well, I got a hospital, a doctor, and a prescription drug plan there. Part C just means it's an HMO type plan. That's the easiest way to explain it. Where you have all the benefits, it has to be as good as Part A and B of Medicare. And normally the insurance companies give you some type of enticement to enroll in their plan. And you've seen them all during the open enrollment periods, right? You get prescription drug coverage, you get maybe some dental and vision and some cards that you can use for over-the-counter medications, things like that. So we'll talk more about that, but it's important that you understand how they work and why they're not super user-friendly, especially for Arden Wood or any of the Rankies. This option I'm a big fan of because you can have both parts A and B of original Medicare and get some type of supplemental coverage. And we'll talk about a couple supplemental plans out there, both Plan F and G, in a few slides. Part D, for non-Christian scientists, most people have prescription drugs. Because you are absolutely the healthiest population I have ever dealt with in my life in 32 years, it's incredible. Nobody takes medication, so you're truly blessed. I see clients all the time that take 10, 15, 20. The record is 34 prescriptions I've seen. So you are truly blessed not using or having Part D. So we'll talk about enrollment periods, because that's important too. When do you enroll in A and B? Because people think, well, does the government automatically do that for me? And the answer is not really, because only if you're receiving Social Security benefits would they automatically enroll you. Most people are not, so you have to enroll yourself. There's really 3 times you can enroll. The first one's the initial enrollment period when you turn 65. I think I used an example for somebody. I said, if your birthday is April 16th of 1956, and believe it or not, I received a call or an email from someone saying you used my birthday. So I just picked it randomly. So what that really means is if I'm turning 65 this year, and a lot of people are in denial, right? You don't want to turn 65, but it's just a number. And with Christian scientists, you're probably living in your 90s and 100s anyway. So it's just you're like a teenager again when you're turning 65. So I can enroll 3 months prior to the month I turn 65, which would be April in this example, that month, and 3 months after. So the government says, listen, you've got a 7-month window to sign up for this. Don't blow it, because if you don't do it, they're going to fine you. And the fines last forever, and you don't want to be fined. The second enrollment period is if you're still 65 or older and you're still working for a company with usually more than 20 employees. If that happens, it doesn't matter if you work till 66, 68, 72, 74. If you haven't signed up for Medicare, you can, when you leave your group employer, you create what's called a special enrollment period. What that means is that the government's not going to fine you because you've been on a group plan. And the government says, now listen, you've got a window, a certain amount of time to actually sign up for both Part A and B. For Part B, they actually give you 8 months to do that. Most people don't wait that long. They do it ahead of time. So when they retire, everything is coordinated and it makes it really nice and simple, right? So that's a special enrollment period. The third one, this last one here, that's bad. That's not good. When you turn about 64, 64 and a half, you normally go on kind of a national mail order house where you get every offer from every insurance company out there about their Medicare products and why theirs the best. And by the way, I've never heard a company ever say that they're not the best plan out there for you. So a lot of them are more interested in your business, just being on the books and really caring about you or asking you questions, especially if you're a Christian scientist. All I can tell you is general enrollment periods, the acronym BAD stands for not good. It's not good, because if you don't sign up during that time frame, guess what? The government can fine you, and the fines can last forever. Right now, if I didn't sign up during my initial enrollment period, or I'm not on a group plan, and I simply said I want to get Medicare now and I'm 68 years old, now's the time during this general enrollment period that I can sign up for it. It's between January 1st to March 31st, and it starts July 1. Don't ask me why they make it so confusing. It would just be easy to say start January 1. They don't do that. I really think it has to do something with the penalty, that the longer you're not enrolled in Medicare, the more likelihood that you're going to be penalized. The Part B penalty that you can see on the screen there, it's 10% for every 12-month period you should have signed up but didn't. That's $14.85 a month for every period right now. I had an individual talk to me the other day. They were 68 years old, and guess what? They've got 3 of those periods. So you don't want that to happen to you. Part D, which most of you, we should talk about Part D, Leslie, because that gets confusing. If you don't sign up for it, and you're a Christian scientist and you never intend on using it, well, you're probably not going to have a fine, right, if you're not signing up for it. But if you decide at 70 or 75 that you do want to sign up for the Part D prescription drug plan, that the government would say, well, listen, you never signed up for it when you started, right, during your initial enrollment period. So guess what? You can get it, but we're going to fine you. So you want to make sure that you totally understand that. I've seen some individuals out there that sign up for these Medicare Advantage, these HMO type plans that haven't had Part D coverage in 5 years or 6 years. And they sign up for one of these plans and all of a sudden they're getting a penalty from the government. That's because a lot of these HMO type plans have Part D built in. Well, that counts as having it. So the government says, well, gee, Leslie, if you waited 5 years and didn't sign up for it in time, now we're going to fine you. So just so you understand how that works. All right. The 4 parts of medical. The first one is the hospital insurance side, like we talked about. The religious non-medical healthcare institutions, which Arden Wood is. Skilled nursing. So that's all covered under Part A. Skilled nursing, is covered, but not custodial care. So we run into that quite a bit when people want to know if they're still covered for custodial care. Do you want to jump in here, Leslie?
I'd love to jump in.
Please.
So Arden Wood is a Part A Medicare provider. That is the only part of Medicare that is available at Arden Wood or any Christian Science facility. And that covers the room, board, and Christian Science nursing care. However, it does not cover the Christian Science practitioner at all. That's separate. And I'm looking at my notes here. Oh, we are also a combination of the hospitalization and the SNF, the skilled nursing facility. So the rules are slightly different for us as far as a period of time coverage. It's kind of a combination, but an individual, they don't just need to be 65 and have Medicare to qualify for coverage. We have to, at Arden Wood, we make the determination that it is indeed a skilled care need. So a situation where someone else might be going to the hospital for that care. So it's not just because someone is using a walker or something. That would not be skilled care, but we can help make that determination. And I think I'll let Jim go forward and then I'll jump back in again when we get to Part B.
Sure. Okay. Sounds good. So Part A also covers hospice, which is end of life care. So that's all covered in Part A. And they also cover some skilled care for home care. When people come out of a hospital or facility and go home, they can also have some, it's limited, but at least it is home health care for skilled care.
However,
So
it does not cover home care for Christian Scientists. It only covers home care where you're under a physician's care. So.
Got it. Thank you, Leslie. That's super important too. Okay, quiz for the day. How much does it cost? Because the government tells you it's premium free and there's nothing free about it, right? That's because when you're working, you are a spouse. If you haven't worked and your spouse does that, you can use each other to qualify for it. But there is no additional premium. When you're working, every time you get a paycheck, if you look at the paycheck and 1.45%, that little small amount that comes out every time you get a paycheck, that's what goes to this Medicare Part A trust, and then the employer matches it. If you ever want to see how much free really cost you, if you look at your Social Security statement on the right-hand side under hospital insurance, that big number there, that's how much free really cost you. So just so you know that. Second part of Medicare is Part B. That's the medical side, the doctor side to Medicare. Covers doctor's visits. Leslie, you let me know when you want to jump in here. I'll put everything up here on the screen. Covers you doctor's office, outpatient surgeries, lab work, x-rays, things like that are all covered under Part B of Medicare, the doctor's side, really. Right. Part B has a deductible. I was going to say it's not free. Nothing is free. I'll show you the premiums in a minute here, but Part B has a monthly cost to it. It also functions like the old 80-20 medical plans where government says under Part B, you've got a deductible this year. And so if John's way too young, but if he were that age, he would pay the first $203 for the Part B. So if he had outpatient surgery, and after that, the government says, well, listen, we're going to pay 80% and you pay 20%. Problem is 20% can be a big number. If you break a bone or something, perhaps, Leslie, I don't know if that's a good example, and you end up in an orthopedic surgeon's office, or
Why don't I jump in here and say,
please.
you know, if Part B doesn't apply in a Christian Science facility, why would a Christian Scientist consider having Part B? And the reasons, it's a very individual choice, but the reasons are, it will cover a physician fee if you were to find yourself in a hospital setting, whether by your choice or not. If you go for x-rays, have a bone set, so an emergency room visit, it will cover ambulance service, not from home to a Christian Science facility, but it will help if 911 were called, it can help with that. It can help transfer someone maybe after having a bone set from the hospital to a Christian Science facility. And the other reason is it is also required if you have a Medicare supplemental plan. They will ask that you have full Medicare coverage.
That's right. I'm going to give, I had an example where I had a knee surgery, an outpatient knee surgery, and I had a piece of cartilage cut out a couple of years ago. Well, they don't call it cartilage anymore now, they call it meniscus. So I had a piece of meniscus cut out of my knee. Outpatient surgery, 8 hours up here at a hospital in Sacramento. The billed amount was $64,000. If I'm on Medicare, that's covered under Part B. You don't want to have to pay 20% of a large number on there. You can see pay 20%. The reason why, there is no cap. There's no out-of-pocket maximum that Medicare says you're only going to pay up to a certain ceiling of $10,000, for example, or $7,000. So it's uncapped. That's why I highly recommend when people have Part A and B that you look at some type of supplemental coverage that puts a limit on what you're going to pay, your exposure.
Jim, I'm going to jump. Can I jump back in here? I think as Christian Scientists, many of us assume and hope that we never need to use this and that we will never be in a situation where medical care is being given to us or Christian Science nursing care is being given to us. We're so expectant of healing and live a good life and all, but situations happen sometimes where we are presented with challenges, and sometimes other individuals may be helping us, influencing us to make decisions. And I think where the general public assumes that they will be paying healthcare expenses, I don't think Christian Scientists often think about that. And the actual cost of care is unbelievable in a medical setting. Having x-rays, just simple x-rays, I've seen $12,000 bills without any surgery done, just the x-ray. I have seen bills for broken bones go upwards of over $100,000. So having that little extra coverage can be very useful. You may or may not ever need it, but it's just something to weigh when you're making your decisions.
Very good. Thank you, Leslie. How much does Part B cost? Everybody wants to know. It's not free. So you can see in 2021, for most people, 94% of the population, you can see the monthly premium up there of $148.50. That's the standard premium. If you're on Social Security, they automatically take that out of your deposit every month. Okay, very simple. But they also means test it now, meaning the government looks at it and says they do a 2-year look back at your modified adjusted gross income. So for 2021, for example, they're looking at your 2019 income. If you exceed those first thresholds there of $88,000 for an individual, or if you're filing a joint return, $176,000, you're going to receive another bill from the government. There's another tax. It's called an income-related monthly adjustment amount, or the acronym IRMA. IRMA's not good, not like Aunt Irma. It's not good when you get those. So you can see up there, the more you make or have made, the government's going to take a little more from you every month. So I'm happy. I've got a lot of requests for that. I'm happy if you want to email me after. I'm happy to email this schedule to you so you'll have it. I have it updated for 2021. So let's talk about my favorite option here with Medicare. So after you have Part A and B of Medicare, you have insurance options. First one, that I like best is the Medicare supplement option. And Leslie talked about why that's so important, especially with Part B costs, having some type of coverage. Normally for non-Christian scientists, I have to make sure and explain why they need a Part D plan. The government says you don't really have to purchase one, but if you don't, they will fine you. So, so it's important for people to understand. Pardon, Leslie?
It's only if you don't have it and then want to use it later. If you never use it, there is no penalty.
That's exactly right. No, that's a great point. So if you're a Christian Scientist and you've never signed up for Part D and you don't, then you don't have to worry about a fine. But if you do, and I've talked to some of you out there, or inadvertently sign up through an HMO, then you're going to be fined. So the government does that, whether you buy it through a straight Part D plan or through an HMO type plan. We'll talk about that here in a minute. Here's Medicare supplement plans. They also call them Medigap plans. So again, you've got to have both Part A and B of Medicare. You pay a premium to an insurance company, and there's several out there. You always want to make sure you've got a good quality insurance company. And you're signing a contract with an insurance company. So it's something that they cannot cancel you because of a claim. It's guaranteed renewable. So as long as you pay your premiums, they can't take it away from you. In California, since we mainly have a California audience today, there's a 30-day birthday rule in California. So if you buy a plan, a Medicare supplement plan F, for example, like Frank, and you've had it for a few years and the premiums, they go up a little bit each year, in California, you can change that to another insurance company's Plan F. And I'll show you why in a minute here, but all Plan Fs are the same. It doesn't matter with which insurance company in the state of California. You can change every year within 30 days of your birthday, and there's no waiting periods, there's no pre-existing conditions. This next slide will show you, I'm gonna pull up here. Plan F was the most popular plan sold, and I've had a couple requests to kind of go through it a little bit more. So Plan F covers you, if you go to the far left there, Part A, basic benefits and co-insurance, you see that Plan F box is checked in full. So whatever Medicare approves, whether I'm in a hospital, Leslie, or help me with a Rinky, right? It's covered in full. With Plan F, you would pay zero. Whatever Medicare approves, Plan F would cover everything in full. The same with Plan G, like George. So that covers you for your Part A. Plan F, let me pull this little tidbit up down here. Plan F is no longer available for people to buy if they've turned 65 after January 1 of 2020. If you are 65 prior to January 1 of 2020, you can still get Plan F like Frank. It's a great plan. If you like easy, Plan F is easy because you don't worry about co-pays. If you're a non-Christian Scientist, we spend a lot of time on Part B. If you're going, because that's the doctor side, lab work, x-rays. Leslie's right, I see crazy billed MRIs out there, lab, x-rays, and if you have Plan F, covers Part B, covers it in full. So you would have no co-pays, no deductibles, no co-insurance. So it's an all-inclusive plan. The only real difference between Plan F and Plan G, like George, if you go down and look on the left-hand side, Part B medical deductible, and you go over under Part G, you see a dash, you don't see it checked. That means you would have to pay the Part B deductible. This year, it's $203. So after you pay the first $203, it acts just exactly like Plan F. So after you pierce that $203, then you'd be covered in full for you to have no deductibles, co-pay, or co-insurance. I hope that helps because I did have a lot of questions on that last time. And I'm happy to email this grid to you too. If you'd like to, just let me know. My contact information will be up there after, and I'm happy to send this out to you too.
Jim, would this be something, because there was such interest in it, that you might send it to us and we could send it to everyone that was on signed up?
That's a great idea, Leslie. I absolutely will do that. That way, yeah, I'm happy to send it to you, and maybe you can get it through Arden Wood or myself or whatever is easiest. Happy to do that.
Great.
Part D, this is a prescription drug plan, and it's optional, right? Rogers, I know we wanted to talk about, make sure that it's optional, but if you do join later on, there will be a penalty. If you never join, there is no penalty. So Leslie is absolutely right on that. These are plans that are offered by insurance companies that are governed by, well, the US government, by CMS, Centers for Medicare and Medicaid Services, but they're run by private insurance companies. And they have all the popular ones. You see them advertised all the time on TV. You can change, if you do have one of these plans, and you're a non-Christian Scientist, you can change every year between October 15th through December 7th, right? That's Part D. Now we're going into talk about the next coverage, which is really important. We need to understand this because some of you have it and you don't realize you have it. It's Part C. It's the HMO type of Medicare. So Leslie's right. If you have Parts A and B of Medicare, you can now qualify to either get your supplemental plan that way, or here's option 2, which is a Medicare Advantage plan. And they're really easy to sell people because they're all on every open enrollment period, which we just ended. Every commercial is about Medicare, right? You've got Joe Namath telling you how great and low cost, and they give you vision and everything, you name it. But what they forget to tell you, which is super important, is that they are restrictive. And people don't understand that until they want to leave or go to a physician or a provider outside the network. Most all plans, Medicare Advantage plans, have some type of initial, HMO or PPO, on their card. So believe it or not, if you look in your wallet, you're going to have, some of you have those cards and they have the initials on them. That's how you tell if you have one. The other way is that they're very inexpensive. I was going to say cheap, but they really are. So how can an insurance company sit there and in some areas of the country charge you $0 or $19 for a plan? Because as we age, the healthcare gets much more expensive. Well, it's simple. The government is reimbursing these insurance companies to take care of you. You still have Medicare, so you still have that, but you now agree to receive all your healthcare services through this particular insurance plan. Kaiser's very popular, Humana, HealthNet, there's so many of them, Anthem Blue Cross, there's a lot of them out there. Very popular because people buy it because of price. It's easy and low cost. Okay, and that's not good because nothing's free. I'm going to tell you about my mom. My mom was a wise woman. She always told me, don't buy cheap shoes or cheap mattress. And she was right. She says it always comes with a cost later on down the road. And she was exactly right. I learned in this industry years ago when I started, I bought cheap shoes because I didn't listen to her. Well, after you buy your third or fourth pair of cheap shoes, you realize if I would have just saved the money and bought the best pair of shoes, my feet wouldn't hurt and I'd have a better pair of shoes. So mom was always right. Don't buy something just because it's $0 or it's $15 or something a month. It always comes with a cost down the road. It really does. But if you do have one of these plans, you can change every year. And there's a couple times you can change. We just ended one, which was October 15th through December 7th. The next one is right now. It happens to be from January 1 through March 31st. We'll talk about that in a minute. I've got a couple slides on that. We'll take our time and go through that. But I want everybody to understand how these HMO Part C plans work, or PPOs. See the physician in the middle there? That's your primary care provider. So if I have an HMO plan, I'm going to that particular doctor. If I say I want to go to somebody in Southern California or a specialist or a hospital in some other state, remember, with original Medicare, I can go to any doctor, hospital, provider in the United States or its territories. Part C says, listen, I'm giving you this plan, Leslie, and it's $19 a month, but guess what? You can now only go to certain physicians or providers or hospitals. That's the way these are built. That R up there is super important to understand because that stands for restrictive, right? You must stay within a network. Do you notice on all those commercials on TV, they don't sit there and tell you, hey, this plan is restrictive. Be careful. If you sign up, caution, it's restrictive. They don't tell you that until people call me and say, I want to go see this specialist, or I want to go to this particular hospital. How do I do that? And I go, well, now you have to undo this thing that you got into for free. Remember that. Everything comes with a cost later on. Okay, this is a slide I added today after talking to several Christian Scientists. A lot of you, you know, when you go to the store, you really want to buy something. If I want to buy a loaf of bread or get whatever grocery item, I'm going there to purchase it. I can make the decision. The problem with Medicare and insurance plans, a lot of times you aren't buying, you're being sold. And I see a lot of this in this industry where you're actually sold something and they make it sound great. If I'm telling Leslie or John or whoever out there that, listen, I've got a plan here, it's great for you. It costs nothing or very little, $19, and it's going to take care of you. It covers part A and B and gives you some vision and some hearing benefits. And boy, it's awesome. And you don't have to worry about a thing. Oh, it's got part D, and I know you don't want it, but now you're going to have it, so no worries. So you're really not buying this, you're being sold this without fully being informed, I believe. After talking to so many Christian Scientists, I really believe that. So if you want to see if you have one of these plans, this is a good example up there. You can see all of them normally have initials on there, right, on their cards. So if you look in your wallet, you'll find one of these cards and see if you have that. That's going to tell you that you have a Medicare Advantage plan. And now is the time, if you want to leave that plan and go back to original Medicare, you can. You actually have until March 31st to do that. So if you want to go back to part A and B, and like Leslie said, it's so important, right? If we want to look at somebody using Arden Wood or Sunland or wherever the other, the 10 are throughout the United States, it's important that you understand how original Medicare and why it's so beneficial to go into a Rinky. I think I said that right, Leslie, did I?
I think you did.
Okay, all right. So all of them have initials. Now we're going to talk about original Medicare again, why it's so important, even for Christian Scientists. I can go to throughout the United States with Part A, and I know you want to use a Rinky, right? And you can do that, but original Medicare is accepted throughout the United States or its territories. So for non-Christian Scientists, or some of you have spouses that are non-Christian Scientists, it's so important to understand you can go anywhere to centers of excellence throughout the United States or its territories. Let me show you how an HMO works. There it is, right there, right? So why would I want to, as I'm aging, have less options for providers or hospitals than I would as I age? I think it's so important to have more options, not fewer. A lot of these HMO type plans have very small networks where you're restricted to where you can go, and they do not work well with Arden Wood or any of the registered non-medical health Christian
healthcare institutions.
There we go, Leslie. Thank you. I know I've been practicing that too. So here's what I think is really a great option for most Christian Scientists. All right. I think original Medicare makes the most sense for you. If you just have original Medicare, though, you have to understand if you go into a hospital or to a Rinky, right, that you're going to have co-pays. And Leslie, you may be best to go over this, right, if somebody comes in.
Yeah, and before we get into Medicare supplemental, I'd like to just speak a little more to the Medicare disadvantage and why it can be a challenge. So the regulations say that all Medicare Advantage plans must provide the same services, cover the same things that original Medicare does, and then sometimes they cover more than that. But RNHCIs, religious non-medical healthcare institutions, which is the certification that we have from Medicare as Christian Science facilities, we are not able to be in network with any of them so far. We have not been successful in that. So they don't seem to understand why, when this individual has reassigned their benefit to a Medicare Advantage, and then we try to seek pre-authorization for admission, sometimes it literally goes to the primary care physician to have his or her permission for this individual to be recommended to receive care here. And they don't speak the same language. They're looking for diagnostic codes, which we do not have. So billing is very difficult, but sometimes just even getting the basic authorization for the patient to be admitted is very difficult. Sometimes it is months later or years later before we receive payment. We have had some amazing workings out, some demonstrations. We've worked with some wonderful Christian Science attorneys and have received reimbursement finally. So we're very grateful for progress and education that's been made with Medicare Advantages, but the hours that go into it, it is exhausting for Rogers and me. So anyway.
And so Leslie, when they come in without a supplement, then can you kind of take them through that they're going to have a deductible, right, for the first
Sure.
60 days normally?
And if they have the deductible, if they were to have a Medicare supplemental plan that would cover the deductible, there are some other options available. And I don't know if this is the right time to go into some other funding that's available, or I don't want to interfere
Sure.
with.
No, I think you should. I think it's
Okay.
important for people to understand all their options. Absolutely.
So there is the National Fund for Christian Science Nursing, which is a very generous fund administered through the Principal Foundation and has several funding sources. And it can pay a daily fee that can help with the cost of Christian Science nursing in a facility, in the home, just a private duty Christian Science nurse or a visiting Christian Science nurse, and can even also work for it doesn't have to be a journal-listed Christian Science nurse providing the care, as long as an assessment's been made. So that's a wonderful resource. And even if someone were in the facility, only had Part A Medicare, then that is where the National Fund can help defray the balance of the deductibles for them during a short term, because Medicare is a short term, not a long-term policy.
Right. As you can see by if they just have original Medicare, you can see the deductible for the first 60 days and then how expensive it gets after per day, 61st through the 90th day and the 91st through the 150th day, how expensive that gets for people. So that's why I always say, does it make sense to have a Medicare supplement plan? So you want to look at that to make sure that you do have that option to make sure those costs are covered. We mentioned both Plan F, like Frank, and G, like George, both cover whatever Medicare approves when you're in Part A of a facility. So that's important for you to understand.
And while some individuals come in and are healed quickly and go home, there are times that there is an extended need for care, even beyond the Medicare coverage time. And even consider the covering that a Medicare supplemental would be covering the deductibles and can go beyond the 150th day. Sometimes for a year if needed, not for long-term care, but for a skilled care need that continues.
That's super important, right? So we'll go on. We'll talk about just the 2 Medicare enrollment periods. We just ended one, the annual election period from October 15th through December 7th. So now we're going to focus on the Medicare Advantage open enrollment period. It's never easy, right? You see more initials. It's just, I have a hard time with it. There's so many, but we're in it right now, and it's important for you because we're going to show you how you can make a change, a one-time change. If you're in one of those plans that has initials, a Medicare Advantage plan, you can actually leave that plan now. You have through March 31st to disenroll from your Medicare Advantage HMO type plan and go back to original Medicare, Part A and B. You can also, and I have to say this too, you don't have to purchase a Part D plan, and you still do have the option to purchase one either way. So you can, or if you don't, that's okay as a Christian Scientist, but for non-Christian scientists, you do have that option to purchase a Part D plan during this time frame. The hard thing here for most folks, I shouldn't say Christian Scientists, you're just unbelievable health-wise, but a lot of people have to qualify for the Medicare supplement during this time frame. It's no longer guaranteed, right? You have to answer health questions. But I got to tell you this, everybody I've talked to, you don't have any health issues. It's just absolutely amazing. The general public is nowhere as healthy as you are, not by far. Most people can't answer the health questions without saying yes to certain health conditions, and then the insurance company doesn't have to take you because there's no guaranteed period. So right now, here's the special offer in California for California residents. If you do drop your Medicare Advantage HMO type plan and you go back to original Medicare, there is an insurance company that will give you a guaranteed issue on a Medicare supplement plan. So if you can't answer the health questions or you don't choose to, we can still get you a guaranteed issued Medicare supplement plan now through March 1st, not through March 31st, only through March 1st. No health exam, no physicals, anything like that. You can absolutely get that right now. So that's a big deal. Most states it's not available in, But again, you can absolutely email me or call me and see if it's a good fit or not. But it is a great opportunity for you to go back into original Medicare. It really is.
And thank you,
This is my
Jim, for
favorite.
doing the research to find this.
Yeah, yes. So, well, no, my pleasure. It's an absolute joy to deal again with all you Christian Scientists. I always tell people you can call me, you can email me. I know the last slide simply has my contact information, and I know that you can get it through Arden Wood, or there it is right there, and I'm happy to try and help you. Sometimes I've been bombarded with calls and emails, but I always try and get back to you in a timely manner as soon as I can. So what else? Were we ready for some questions and answers, Leslie, or is there something you wanted to go over?
I think we are ready.
Okay.
Okay.
Can Rogers join us?
There we go.
Welcome, Rogers. Rogers has, as earlier stated, the most amazing ability to sort through the paperwork, which is so intensive. Just grateful for all Rogers brings. Great seminar. Your clear explanations have been so helpful, and we're happy to serve as an ongoing resource in understanding Medicare. So please don't hesitate to call with questions at any time. We're standby, ready to help. So now let's answer some of your questions. I've got a number of them here. The first one is, and I'm going to give this to Leslie. We've talked about it a few times, but Leslie, what again is an RNHCI and why is that important?
Okay. Ever since the beginning of Medicare, Christian Science facilities have had an accommodation, and they used to be called sanatoriums. And then Medicare has changed our name, our designation, to be not sect specific. So they're the ones that gave us the name, religious, non-medical healthcare institution. But to date, Christian Science facilities are the only type of facilities that have fit into that category.
I believe that legislation was like 1991 or something. I know.
I think it's 19, maybe it's 2000, around there.
2000, really? Okay.
Yeah.
Great. Second question, if you apply for Medicare Part B and find it too costly, how do you cancel Part B?
Wow. I don't think I've ever had that question asked. You would call Social Security and talk to them and disenroll from Part B. Most of the time, you always have to keep Part A. If you're receiving Social Security, you have to have Part A of Medicare. So you would call 800-772-1213 and have a talk with Social Security about disenrolling from Part B of Medicare.
Great. Question number 3. Leslie spoke about a fund to help with expenses. Is this fund just for those who need financial help? And is the fund limited to Christian Science facilities?
It is limited to Christian Scientists, but not to facilities. It can work for the home care, facility care, as long as a Christian Science nurse is the one providing the care. So the National Fund for Christian Science Nursing. And Rogers, go ahead.
Yeah, the other thing that I've seen in the National Fund for Christian Science Nursing is that while it is asset-based, they are very
generous.
Very generous. That's the word. Thank you.
Mm-hmm.
Very generous. And I think they're recognizing their thought is they want to support Christian Science healing, and they recognize that when you have your healing, you need your assets to continue to live independently and move on. And so it's not requiring that you be spending down to your last penny on healthcare before they will kick in and help. So it's a fabulous fund.
Right. And it's renewed every month. So if the need continues, you can basically renew each month.
And I will say, just as someone who is involved in setting it up, there is no means test, to your point, Rogers, but I think it is understood if the individual is not in need of financial assistance, it is hoped that the people who really need the financial assistance will receive it through the national fund. That's the way I understand it. So, question number 4, what is a Medigap policy and how is it different than Medicare coverage?
Well, Medicare coverage part, is that, do you want to do that, Rogers, or do you?
Whatever, no, go ahead.
So original Medicare, right? That's Part A and B. Part A has deductibles and co-pays, and Part B has a deductible and co-insurance. So if you have supplemental plans, you purchase that to take care of the deductibles or the gaps, right, that they call on those plans. So you purchase a policy through an insurance company. They all have different letters, and you just find out which one works best for you.
Great. Question number 5. What is a premium deductible as mentioned on Tuesday, and how is it different from the $203 deductible as in insurance plan G?
So if you have insurance plan, Medicare supplement plan G right now, we know, just to review, the Part A side, if I go into a facility under Part A, that's 100% coverage, whatever Medicare approves. If I go outside, if I break a bone and I have to go have lab work, x-rays, have the bone set, outpatient surgery, that's all covered under Part B of Medicare. Part B is the 80-20 plan after you have a deductible. This year, it's $203. So once someone pays the first $203, then they're going to pay 20% of the Medicare approved rate under Part B, right? And that's the one that doesn't have a cap. That's why people look at doing some type of supplemental coverage that takes care of those co-pays or co-insurance.
Great. And I just want to interject too. It was mentioned, but I want to state it again. I think Christian Science and Christian scientists in particular have no idea how expensive medical care can be. For instance, if I found myself once, I'm not Medicare age, but in terms of what the costs are, we had full insurance. So we were completely covered because of a situation in our family. We had to have insurance coverage. And I was out of network because it was through an HMO with spending, and I was taken to the hospital. In less than 30 minutes, it was $10,000. And luckily, Lesleah helped out in getting me out of San Francisco General. Otherwise, they had a battery of tests lined up for me to take, which I would have paid for in full. So the costs, and this is 10 years ago. So I can't understand. People need to understand how expensive it is out there. And that's why you have this sort of thing.
And John, that was because someone else called 911, not because you did.
Right.
So, sometimes situations are out of your control.
Exactly. And just so I know that when people have the Advanced Healthcare Directive, oftentimes, even if you have that on your person, the ambulance drivers, they are taking you automatically to the hospital, end of story, because that's what they're told to do. So even if you show them or someone shows them the Advanced Healthcare Directive, you most likely are going to go to the hospital and then be able to leave the hospital. Isn't that correct, Lesleah? That's what I found.
Yeah.
Yeah. Question number 6. More info on Section F, please, regarding Blue Cross, regarding eye care and dental. Thank you.
Well, that's easy. Medicare doesn't cover vision or dental. So some of the supplemental plans will give you some type of vision, maybe very limited, but some type of vision coverage. But for example, medical necessity like cataracts, things like that are fully covered under Medicare, but just regular vision eye exams aren't. So companies offer enhancements on their plans to get somebody to purchase from company ABC instead of company XYZ by offering maybe a very limited vision and some hearing aids, for example, versus company XYZ that doesn't offer that. So again, Medicare doesn't cover them. Insurance companies try and entice you to come over to them by adding different features and benefits.
Great.
Maybe, John, on that question, it seems to me that maybe in the background is lurking the idea that the supplemental insurance is general health insurance. And I just want to make sure that everybody understands that the supplemental insurance we're talking about only works with Medicare.
That's right.
Great point of clarification. Question number 7. This is maybe not a question, but a statement. Part A is free if you are insured, and there's no penalty if you file later than age 65. Of course, folks should file prior to age 65, but there is no penalty. Is that correct?
For premium-free Part A, that's correct, right? Yes.
Great. Question number 8. Could you clarify what Medicare covers and doesn't cover with respect to Arden Wood's services?
You want to start with that, Rogers, or do you want me to jump?
Sure. Well, first of all, to be a Medicare qualified stay, as Leslie had mentioned before, there are several. I guess I'd have to say it has to be of a severe enough nature that it would qualify for this. It's and our nursing staff and we have a committee that would go through the exercise to determine whether someone qualifies or not. Once that's set and you're qualified for a Medicare stay, then, as Leslie mentioned, our nursing care, the room and board are all covered under the Medicare. But Medicare is a short period. Day 1 through day 60 is covered by your, they cover everything once you pay the deductible. From day 61 through 90, you pay a co-insurance, and they'll pick up the rest of that. But again, those the deductible is $1,484 this year. So when you basically walk in the door, that's what we have to assess you by Medicare rules. The copay for day 61 through day 90 is $371 per day. So if you are here for all 30 days of that period, that's a little north of $10,000. And then the lifetime reserve is for day 91 through day 150. As Jim's slide showed, that's $742 a day this year is the co-insurance. Those fees could be mitigated by the supplemental insurance that they've been talking about.
So Medicare pays everything over the amount that you pay or your insurance pays. So by the time you get to lifetime reserve, Medicare is not covering very much. And then it just kind of fizzles out.
Yeah.
So, yeah. Now, the other thing is it's not a given that you have 60 days free ride, because we're expecting healing. We're expecting you to come in, be cared for, be healed, and go home. So that's the really important thing. So it may be that you're here for a week and a half and then you go home. Wouldn't that be great?
Yes.
So that's what we want to keep in mind. Exactly.
We want that healing. Yep.
That's the expectation.
John, I'm going to show something here. This is a great source. So I don't know if you can see, it's called Medicare and You for 2021. It's a great source. It shows what's covered, what's not covered under Part A, Part B. It's free. You can go to the Medicare.gov and download it. You can request a copy. It's my Medicare go-to every year. That's why I put my name on this one, because people want to grab it. It gives you everything you're asking. You can find in there what's covered, what's not covered under Part A, Part B, things like that. It's a great resource for you, and I love going through it because it seems to change a little bit, but it's a freebie and it's really easy. Just Medicare.gov.
Perfect. Next question. This is a good question. At 65, I applied for Social Security. When Obamacare began, I thought I didn't have to enroll in Medicare. I thought I was already qualified. because I was over 65. If I enroll now, am I really going to have to pay penalties for all those years?
Yes. Yeah, the government's not forgiving, right? If just because you were on an individual plan and at 65 you didn't sign up, but normally if you're on Social Security, right? That was part of the question. If you're on Social Security,
Yes.
right? Normally they automatically send you a Medicare card. If you're receiving Social Security, they send you a Medicare card, Part A and B, and then you have to decide if you want to keep the Part B side. They allow you to send it back if you don't want Part B. So, but if you have been without Part B, right, it's 10% for every 12-month period that you should have signed up and didn't. They're going to fine you.
But is there a penalty for Part A? There probably isn't.
No, not if they paid into Medicare. Yeah, right.
Yeah.
Next question. Also, we have already on our website, on the ardenwood.org website, we have a Medicare booklet that is explanatory in what we're talking about right now. So be aware of that as well. It's already been updated for 2021.
You know, one other thing we have on our website that could be really useful is a sample advanced healthcare directive. It was actually vetted by attorneys from California, but really helpful that you, should you ever be in a position where you're not able to speak for yourself, that there is someone authorized to make decisions for you that will respect your choice of care. It's such a protection for Christian Scientists.
Can you maybe give an example of that, what we experienced here with our friend?
Some years ago, a church member was having a physical challenge and did not choose to disclose that to friends and church members. And the church received notification by a neighbor calling to notify that that individual had been taken to the hospital, and they had collapsed at home, and the neighbors heard it and they called 911. So this individual ended up in a Catholic hospital, and it took about at least a week. So by the time we were notified, we immediately went to visit. The individual had no family, did not have an advanced healthcare directive. And even though the individual really wanted to be at Arden Wood, they did not want to be where they were. They could not get out because the physicians determined in that situation that this person was in, they must not be thinking clearly, they must not be able to make their own decision. And it went to the hospital ethics committee, and several of us went to visit regularly, ended up locating some friends of this individual willing to be named as agents and able to sign an advanced healthcare directive. We took a notary with us to the hospital. Once that was signed, the very next morning, they were willing to release this person, and they came to Arden Wood. So it was quite a battle for this individual to go through at a time that they really needed the right kind of environment and support. So
everybody's trying to do the right thing. That's exactly right. Everyone, the hospital was trying to cover themselves in terms of they could not, let go of someone because this individual did have needs. So if anything were to happen, they would be liable, et cetera. So everyone's trying to do the right thing, but having an advanced healthcare directive is
ticket out.
Absolutely essential. Absolutely essential. And it's a protection to you, the individual, as well as people that love you.
It's a protection if there are family members that may not be as supportive of Christian Science as a choice of care, to have it clearly stated that this really is what I want in a situation where there might be greater care needs, and they will honor that. I've also seen family members truly honor it, even though that may not be their choice. They respect the fact that that individual has clearly stated that, and it protects them.
It is a legal document, exactly.
Mm-hmm.
On Tuesday, next question. On Tuesday, Jim mentioned Part F and Blue Shield, I think, that didn't put the applicant through a lot of processing, exams, questioning, et cetera. How does Arden Wood deal with Blue Shield? Do they pay promptly? Sounds like Plan F would be a good plan for an extended stay in Arden Wood.
Well, we've on a straight supplemental, they process fairly well. Blue Shield is and I just found this out from Jim last Tuesday, that I didn't realize Blue Cross and Blue Shield were two separate entities in California. We have had problems with Blue Cross in administering insurance here, but Blue Shield, to be real truthful, I have not had a straight Blue Shield policy here to actually administer. All the policies we've had have been Blue Cross Blue Shield, which have been somewhat difficult. We have gotten paid on most of them. There's been a couple that we have not.
Yeah, just to step in too, Blue Shield of California is a nonprofit, and Anthem Blue Cross is a for-profit company. So in California, they're different. Think of them like Ford and General Motors, for example. They're totally different. Other states, they run under Blue Shield, Blue Cross of Nevada, or whoever it's going to be. But in California, they're separate. One's nonprofit, the other is for-profit. When I started in this industry in 1989, I've always felt that Blue Shield's always seems to find ways to try and pay claims. So that's why they've always been one of my favorites, actually.
The other thing, maybe step in here too, is on that particular one, if you've recently moved to California and you started your insurance in another state, sometimes that adds complications, especially with the blue companies. They have a special program it's supposed to go through, but it has definitely added complications. So you may want to get your insurance updated to your new state of residence, in California.
One thing, we talked about this on Tuesday, just want to quickly interject that these Medicare Advantage plans that we've been talking about, one of the reasons why we're calling them disadvantaged, just to reinforce that, is that imagine that you're in a business, whatever that business is, and you provide a service. In our case, we provide care. That you provided that service, consulting, you built cabinets for someone, you fixed their car, whatever you did in your line of work, and you never got paid, or you got paid 2 years later, or you had to spend literally countless hours on the phone weaving through an insurance company trying to get paid. That's what we're talking about. And that's why we want to make sure you have the choices, as Jim was saying, in terms of original Medicare, but also for us as a provider, just to get paid for services we've already provided.
Yeah, the thing with the Advantage plans, a lot of times they're termed they manage care health. They're managed plans, and I think of them as, yes, they are the ones that are managing your health. And we've sort of gone through that as to Jim's slides there showing that the central doctor has to give the okay to go to different places, and so that's you have signed over your right to manage your care to these facilities by taking their insurance.
And along with that, it is medical personnel that are making the decision whether they're going to authorize it and how long they're going to continue to cover you. So that's why it's really hard, because we can make an honest assessment based on, we're seeing the care needs of the patient and we know that it's still skilled care, but without diagnosing and sending codes and all that, we can't always convey that to the insurance company. And they just think, well, there's no medical here, so this is not skilled care, but it may be very skilled care. So it's just trying to convey so the patient is able to have the coverage that they deserve.
And that we, or Broadview, or Sunland gets paid. Mm-hmm. Next question. So I assume that if you do not have one of those HMO type plans and don't have to switch, you can still buy the new Medicare supplemental plan. Yes?
That's true. Yes, right. You can. It's probably not guaranteed. You'd have to answer the health questions to get it, but basically you can apply every month if you have a current plan and see if you qualify for a different plan through a different company.
Great. Can I choose Part A only without incurring a fine for not having Part B?
No, not according
well,
to the
you can
government.
you can choose Part A and you will only have Part A coverage. If you then decide to go to Part B, you would, just as Jim showed all through his slides there, yes, you would be then liable for a fine. But if you only choose to go with Part A, there would be no fine. Is that right, Jim? Am I, I get that right?
Right, as long as you don't, when you sign up, you're going to get, that's a big fine if somebody eventually needs some type of Part B service. So I would take, on the other hand, I would say sign up for Part B myself.
How do you purchase Plan F?
You call me or email me. It's easy.
Perfect.
Really, that's what I do for a living. So insurance companies pay me so if somebody calls me and we do company ABC or XYZ, insurance companies compensate me so there's no cost to you, to the consumer.
Excellent. This is directed to you, Jim. Jim, I still have a high deductible Plan F supplement, which Blue Cross no longer provides. Would you recommend I continue with this plan? Thank you so much for this presentation.
Yeah, it's without knowing anything about your finances, it's kind of hard. High deductible, you're taking, for example, the first $2,000 and self-insuring, saying I'm going to pay that. Then after Plan F would come in and pay 100%. So without knowing a little more about you, it's hard to answer that, but that's kind of the difference.
Next up, is Blue Cross the only insurance company that does not ask health questions when signing up for supplemental insurance?
So during this time frame, right? Blue Shield, not Blue Cross, but Blue Shield of California has a special where you can leave your Medicare HMO type plan, Medicare Advantage, and come over to original Medicare and get a supplement, and you can absolutely get a Medicare supplement plan F or G guaranteed with no health questions right now. That's why we're doing this, John. We said in a timely manner, because you don't have that long to act, really. After that, you can still do it, but you have to answer the health questions. It's not guaranteed.
Great. Could you repeat the information about when I need to sign up for Medicare if I'm covered by health insurance through my company when I turn 65?
Sure, yeah, it's called a special enrollment period. And you know what? I'm going to tell you, it's right in here too. They have a whole section on special enrollment periods in the Medicare and You, the 2021 guide. And it'll show you in there that you're not subject to fine as long as you follow the guidelines and sign up for Part A and or B in a timely fashion after you leave employment. The group plan with more than 20 employees protects you because when you're in that situation, the group plan is the primary payer, Medicare secondary. So if you haven't signed up for it, that's okay. But as soon as you leave, you have a window, a time frame to sign up for Part A and B.
This is a little more detailed question. I have Medicare Advantage plan through University of California. I was sold this new plan a couple of years ago. It's called UC Medicare Choice through United Health Care. My first question is, UC has open enrollment in November only. Can they not offer this additional period now for re-enrollment?
That's a question you'd have to talk to their HR because it sounds like you're on a group Medicare retiree plan, which is a Medicare, you put down with a PPO, it's a Medicare Advantage plan, but those are special different rules. So you would have to check with your HR department to see if you're eligible for disenrolling with them.
And that's her second question is, or his or her second question is, does Arden Wood have experience with United Medicare Advantage?
United Health Care, Medicare Advantage.
Medicare Advantage, I don't know.
Yes. Rogers would know if they've paid. I know I've worked with them. I think they have.
United Health Care, we have had some experience with them. We did get paid. It was not easy. None of the Advantage programs have really been easy to get paid through.
It's often on appeal. It's often a really delayed process. You get denied
Yes.
and then you appeal and then reappeal.
Right. Yeah. Most of the appeals go, several levels of appeals, it seems to, and drags out in a lot of time. And these are things too that we'd be appealing on your behalf. And so you would be involved with getting letters and having to sign documents that we would be drafting for you, but then we'd have to, have you sign them and send the appeal to the insurance company. So it's definitely a lot of work.
And we'd work with the attorneys to have the right language to try to explain to the Medicare Advantage plan why they are required to be paying this. And that it takes quite a while. I wanted to make a clarification too. I know this specific question spoke about a United Healthcare Advantage plan, but there is also a United Healthcare supplemental plan. There are a few companies that offer both services and they are different. So know what you have, because United Healthcare supplemental plan, we do not have any issues with file, right, Rogers? Those
Yes,
go right through as supplemental plans. It's the Advantage ones with United Healthcare that are problematic.
That's right. Yeah, their supplemental plan is excellent. I've used that for years with clients. I'm a big fan of the AARP United Healthcare supplemental plan. I think they're one of the top companies out there. I think they do an excellent job paying claims.
And they've been good for us to work with. We've been able to put the claims in and get them paid in very reasonable manners for the most part. Yeah. So but again, as Leslie said, that's a supplemental plan with a traditional Part A, maybe Part B as well. But the traditional plan, not an Advantage plan.
This next question kind of goes to the heart of what we're about here. It says, you have given so much information that I'm confused. How do I handle that?
Sorry.
Yeah. Personally, I think what I do every day, because I'm zealous about learning more about Medicare and things, you can really just start researching some yourself. You can go to Medicare.gov. There's some great CMS, Centers for Medicare Medicaid Services. They've got there's great information out there. You just have to go look for it, and it's there to help you. There's some great resources, but it is confusing because everything's an acronym, an IEP and SEP and OEP and MAOEP. No, it's confusing, but you have to be a good consumer and start kind of advocating for yourself and go out there and start looking and educating yourself too. And I'm happy to try and help with that too, because it is so confusing, but you really do need to be a good consumer.
Yeah, and I was going to suggest exactly with that. Phone calls. I'm more than happy to speak with anybody on that. But I cannot make a decision for you. Arden Wood cannot make a decision for you. Jim can't make a decision for you. We can say this is what we see. Jim has all the legal qualifications behind him. I'm not an insurance broker. I just deal with the insurance companies on a daily basis here for Arden Wood. And so we can tell you what we experience, but you have to be able to make that decision on yourself though too.
Here's a good one.
That's a good point, Rogers. I am not a legal attorney at all. So no legal or tax advice, simply understanding Medicare. But always ask. And like you said, I'm happy to try and point you in the right direction too, if I can.
Here's a good question. Because of my children's needs and desires, and this is often how things work within families, as we know, I've decided to get a Medicare Part D plan, and I chose the least expensive one. What can you say about Part D plans?
But the government says if you don't have them, they will fine you. If you get one later, they will fine you. So you have one. So Part D plans are all different based on different drug formularies. I think SilverScript has a plan for $7.20, and their plan's over $100 a month. If people are taking a couple generics and you want to get a low-cost one, And they vary. You have to look at each plan and look at what's covered depending on what medications you're taking. And again, you're never stuck in one. You can change every year as your needs change.
Next up, sounds like you're recommending original A and B for Christian Scientists. Sounds like you're also recommending a type of supplement, C, maybe F or G. I only have A and B. What specifically would you recommend?
So C, that's all these initials again. So C is the HMO. Remember, that's the Medicare, as Leslie said. What'd you call, Leslie? Disadvantage?
Disadvantage.
Okay. So I like, if you want original Medicare A and B, then some type of supplemental coverage like Plan G, Plan F. There's several of them. Those are the most popular right now. But a Medicare Part C, that's a Medicare Advantage plan. Those are not the most user-friendly, right, Rogers, with a
Yeah,
Reiki?
definitely. Now, the other thing on that, Jim, isn't there also, just to, unfortunately to make it a little confusing, but there's a whole slew of supplementals, A, B, including a C supplemental.
Yes,
But
sir.
it
there
is
used to be-
not
there's-
the Advantage. It's not Medicare Advantage.
Right. There's an alphabet soup full of them. They've taken away some letters. They've added some. So that you're right. I was going to try and find a visual here. I don't think I can find it though, Rogers, but you're right. There are other ones and it just gets confusing. So I don't think, all you have to know is Part C, not Plan C. Part C is the HMO Medicare Advantage type plan.
Yeah.
Here's one. I was in a hospital one night. I applied Medicare Part A. It was not honored because I went into the hospital through an emergency entrance. Is this right?
Okay, so this opens in the non-Christian Science world. There's a whole issue over being admitted into a hospital and being under Part B observation. It's a big deal because, so I'm going to speak non-Christian Science for a minute here. So if I go into my aunt in San Jose, actually this happened to her. She was, my cousin called me and said, hey, my aunt, who was 94 years old, was taken to our Connor Hospital in San Jose. And I said, great, you need to find, she fell and 94 years old. And I said, you need to find out after if she was admitted or under observation. And he goes, I don't know what you're talking about. I go, you need to ask. He goes, Mom was taken by an ambulance to O'Connor, where she'd been previously in the emergency room. They put her in a room. And he calls me at 11 o'clock that night and said, and he's a CPA, he's a really smart guy. He goes, she's not admitted. Well, what does that mean? I go, well, she's not under Part A of Medicare. She's under observation, Part B. And that's a real problem in the non-Christian Science world. The reason how people find out about that is that if my aunt was in there for 3 days, discharged on the 4th day, normally that's the trigger to be able to go into a skilled nursing facility and have, and I don't want to go too far down the rabbit hole, but that's when people find out they weren't admitted in the hospital. Even though they spent the night in there a couple nights, they go in and they find out that they have to pay up front. So if my cousin had to say, okay, well, Mom's now in a skilled nursing facility, but I thought Medicare paid for it, and they said, we need $12,000 up front. That means they find out that she was not admitted under Part A. She was admitted under Part B observation. Part B does not cover skilled care. It's super important if you have a non-Christian Science a spouse or a neighbor or a loved one that you understand that. They actually passed a law that now they have to notify you if you've been admitted under Part A or you're under Part B observation. But quite honestly, if they told my cousin, hey, your mom's being observed, she's under Part B, he would probably say, well, gee, that's fantastic. I'm glad you're observing her, right? They don't understand it. And that's a big deal. And people find out when they actually go into the skilled nursing facility. So I usually speak 10 or 15 minutes on that when I do present to non-Christian scientists. That's super important. You need to ask and find out.
We don't have that issue here.
No, you're not Christian scientists. You're great. You don't have to worry about it. So,
well, we're already at 5:30, but I've got a couple of other things here that someone just wrote. Tried to download the Advanced Healthcare Directory from your website, but there's an error message with nothing found. Great question. We are in the process of transitioning from our website to a newly redesigned website. And somehow it's already started. It was supposed to start this weekend, but it has already started. So please check again on Monday. You will be able to access it, as well as any Medicare information that we talked about with the booklet and so on. But anyway, we are transitioning, and it started before. We don't know how it started, but anyway, it's going to the new platform. Do all Christian Science facilities charge the same? Do all nursing facilities, non-religious too, charge the same?
Not at all. It's all over the map. There's quite a range, and for a lot of different reasons.
Another one, I actually went to my local Social Security office with an appointment when I moved to California, to somebody else that the statement had made. They were so helpful and patient, got questions answered in person. Note, I took a book and was all prayed up.
Good move.
Does getting Part F or G require a conversation between Blue Shield and the person covered? I asked because my mom has a diminished mental capacity, but I'm not yet her advanced healthcare directive agent. Good question.
So are we talking non-Christian Science? Is that what she was saying?
I'm assuming that she is a Christian Scientist.
Yeah. Oh, okay. I can only speak on the power of attorney. That's what we talk about all the time. It's so important that if you're a non-Christian Science, you have the power of attorney that authorizes you to act on behalf of your loved one.
It's important for everyone to have that.
Yes.
Yeah.
And here's something super important. I'm just going to throw this out. If you're signing, I had an individual come in the other day and say they signed for their mother in a hospital, and then the hospital came after them for payment for the mom. So, for example, when my father was hospitalized in the hospital, I have power of attorney. When I signed my name, I signed it James T. Maher, power of attorney for my father, because that's his estate and Medicare follows him. I'm not responsible for the bill. My father's Medicare was. So in the non-Christian Science world, that's super important that you have that and you understand. And when you sign for your loved one or your parent, that you make sure you sign as power of attorney. You have to have it, of course, but you always sign as power of attorney.
Tuesday, I think we can maybe keep going. We still have about 66 people on. Maybe we can just go on for a few more minutes, if that's okay for everybody. Because it is confusing and there are a lot of questions that need to be, and that's why we're offering these. Tuesday, you mentioned that AARP has been forthcoming for payment. To sign up for AARP coverage, is one supposed to have signed up for AARP membership before acquiring their insurance for Medicare? They send me advertisements all the time during the year. What is that about?
Yeah, no, they're great at marketing, that's for sure. Yes, to have their Medicare supplement plan here, which I'm holding up the latest one in California, you have to be a member of AARP. You and your spouse, it's $16 a year, and that covers both you and your spouse. But you do have to be a member to get the Medicare supplement plan. Yes. And you sign up when you get the Medicare supplement, or you call their 800 number, and they'll probably ask you if they'll give you a discount if you pay 30 years in advance or something. They're very good at giving discounts and offering you to pay.
Next up, if a person is covered through a spouse's employment health insurance, I think you are not penalized for Part B once you no longer have that, right? It would be the
Correct,
regular
yes.
premium without penalty.
That's correct, yes. You or a spouse, same thing.
Great. Is it correct? One does have to have both Part A and Part B in order to get any supplemental health insurance coverage?
Yes.
Great. So I'm just going through these quickly. I think this is a fair question. I still don't understand how to get parts F and G.
Yeah. See, was my information up there, Eddie? Call me.
Call Jim.
Yeah, just
Call Jim, yes.
yeah, and the information will be put up as the last slide when we do sign off. The information for contacting Jim, Leslie, myself, John, will, Arden Wood will be up on the screen.
let's see here. About how much would Part F cost per month?
It's based with AARP, United Healthcare, for example, it's based on the zip code. So in Northern California, we're in a less costly area than, for example, in Los Angeles, but it's all based on your zip code and your age.
Great. Want to make this the last question so we could put up the slide that has Jim's information and so on and our information. If I have Part A and B, can I sign up for Part F or G without a health exam?
Only during there's a certain window after your Part B is activated. For the Medicare supplement, they give you a 6-month guaranteed window to get that Medicare supplement, regardless of any pre-existing conditions. After that, you have to answer the health questions.
Great. We'll let that be the last question. Thank you one and all again for joining us today. And if you know someone who does not use a computer or smartphone, we can mail information to them. So please let us know. This is a unique, time-sensitive opportunity. So I want to thank Jim and Leslie and Rogers for this wonderful opportunity, and would love to continue to stay in touch. So goodbye for now. We'll see you again in early March. Thank you
Bye,
all.
everybody.
Bye now.
Bye now.